even though I am a proponent of health reform and I do want this to move forward, I would be happy to honor any opinion, answer any question. It's really important for us to be honest and have a full debate in our society. So what questions do people have about anything I talked about? Yes, sir.
We've been hearing since the Clinton administration that Medicare is in serious trouble and is going to run out of money. Mm-hmm. The last figure that's been banded out is 2017. What will that do to senior citizens who cannot buy insurance on the open market and have to depend on Medicare for health care?
That's a really good question. So did everyone hear it? We've been hearing since the Clinton administration that Medicare is in serious trouble and is going to run out of money. The last figure we heard was that it would start having fiscal problems in 2017. And actually, some of the provisions in the bills that passed through Congress were going to bring that up to about 2024 in terms of how long before fiscal problems happen, and then what would happen with seniors. So Medicare's fiscal problems are like anything else. It's true that it has significant fiscal problems, but then again, it isn't as though the sky has to fall. And anyone who wants a deep, but a really easy to read discussion of this, go to the Kaiser Family Foundation, www.kff.org, go to the Medicare tab, and it will tell you all this. Our Medicare program is going to be in significant fiscal problems for several reasons. One, medical technology. We do have the best healthcare system in this country, even though not everyone can get healthcare in this country. And every advancement that improves our lives, extends our lives, that treats diseases that killed us days ago, years ago, months ago, decades ago, costs a lot of money. And so the advancement of medical technology is driving up the cost for everyone. And since we have 45 million people on Medicare and growing, it's driving up the cost for Medicare. The other thing that is driving up the cost is our aging population. So we are seeing the baby boomers retire. We're seeing that the shift in population of wage earners, the people who are paying payroll tax to pay for Medicare, is going down, while the number of people needing Medicare is going up. So yes, we have a problem. That has been the significant motivator behind trying to get comprehensive federal reform, has been the lack of affordability for the government in Medicare and Medicaid, and the lack of affordability for us when we get sick, the rising cost of health care. And a lot of the provisions in those 2,000-page bills were about trying to control costs and make things more affordable to improve and extend the life of Medicare. One really quick example. If 3 people fall on the street at the same time and our knee turns inside out, it matters very much what kind of insurance you have. What happens? You go to the doctor, and under a system that prudently treats based on cost and effectiveness, a doctor may say, it doesn't matter whether you did this, that, or the other, we treat it with physical therapy. So we're going to treat you with physical therapy, and then, if that doesn't work, we might have to do more diagnostic testing, right? So we might have to figure out what's going on in there, but almost everything it could be, we treat with physical therapy. So the most effective and cost-effective treatment is to just give you physical therapy and not give you the MRI and the this and the that. Well, if you have some kinds of insurance that are more generous, even including those Cadillac plans, so-called, they may, because the insurance company will pay for the test, well, let's do the test. Your insurance company covers it, let's do it. That didn't improve your outcome at all. It didn't change your treatment. So those are the kinds of things that they're looking at with the lens of Medicare and Medicaid to try to save those programs. So yes, health reform and making Medicare and Medicaid more cost-effective, outcome-driven is part of health reform and part of what we have to do to save Medicare. But one other thing to think about is we are in this country in a really challenging place where we don't like the word tax, right? And we don't like having to collectively give any government entity money to administer programs. The Medicare system is going to need some way to infuse resources as people, more and more of us get to it when fewer wage earners are paying into it. So whether that's a change, which is part of how they did in health reform and what we spend on Medicare, or whether it's a change in how much we invest in it as individuals through our tax system, we are going to have to figure out how to raise resources, and that's a very hard conversation that this country hasn't yet had. And of course, if the Medicare system went bankrupt, we would be back to pre-1965 where, this is the caregiver issue. If you read President Johnson's speech when he signed Medicare into law, he was talking about y'all. He was talking about families not being able to continue to work and thrive because they were caring for their elders. And they were doing so without any insurance. And they were having to care for them at home, and they were having to sell things and sell their houses to pay for people's medical care and going into the poorhouse to do it. President Johnson's speech is amazing. So no, if we lost the Medicare program, we would be back to a time where seniors would be driven into poverty and not get health care, and families would be driven into poverty because we couldn't adequately provide for them. So that's an important question. Yes?